Hi, I'm Kelsi Sykes. Many of you know me as the daughter of Keith and Sonia Wade, and more recently as the wife of Skylar Sykes. I've been off at school, and as some of you know, I'm in graduate school right now to get my doctorate of physical therapy, and I'll be graduating this coming May. Yay! And I wanted to share a little bit about an experience that I got to have a couple weeks ago when I got to go with a ministry group to Guatemala to do physical therapy on some of the local people there. So this past December, I got to go with 15 of my classmates and some other therapists from the San Antonio area, and we combined with another university from St. Louis, and we joined ministries with an organization called Hearts in Motion. Hearts in Motion hosts different medical groups down in Guatemala so that we can minister to the local people there. We were stationed in Zacapa, Guatemala, and from there we would go to surrounding smaller towns and do physical therapy for 4 of the days that we were there. So another patient population that we saw while we were there were patients that had been affected with a virus that was known as the chikungunya virus, but better known as the chimichanga virus by our group, for lack of a better phrase. And with this, we had patients coming in who, it comes on as flu-type symptoms. They get aches and pains all over, they get fever, and they're so drained of energy that they can barely even walk when they first get this virus. And so part of our treatment that we were able to do that was just to show them some simple motions to help alleviate some of those pains that they were going to be experiencing, and then educating them on the course of this virus and to let them know that this is not a short-term thing, but these symptoms could last up to 6 months or even through their lifetime of these joints. So we were able to just better educate them on that, give them some simple techniques to just help soothe the pain through this tough time. So probably the most profound patient that I got to work with was a little girl. She was almost 2 years old. Her mom had brought her in really concerned because she wasn't developing at a normal rate as most 2-year-olds. This little girl, when brought in, she couldn't even control her head. She just laid there. But part of what we did when we worked with her is to help the mom, to show her how to facilitate these motions to hopefully promote this normal development. We answered concerns that she had on feeding problems, the lack of the ability to roll over to sit up, and just to help the mom through that time. We also encouraged the mom to seek out further medical testing from the doctors there and to not give up on finding the diagnosis of her daughter. And I guess the hardest question I had to answer was if her daughter was going to walk. So the difficulty with that is to the knowledge that I had from the textbooks is that she's probably not going to walk. But the beliefs that I have as a Christian, I'm not going to tell her that, because I know that I serve a God where anything's possible. And so I'm going to keep encouraging that mom to work as hard as she can, and I'm going to help her through that process. And I'm going to do that with patients here in the U.S. that I come into contact with, and just make their life as functional as possible. But to show them to not give up, but to keep being the best parent that they can be, which she was doing. And so that was probably the hardest, but yet most touching experience that I had out of the whole trip. So my challenge to the rest of you through my story is don't be afraid to reach out. Don't be afraid to go out. Whether or not you're shy or you're outgoing, everybody can do it. And just share the gifts that you've been blessed with. Go bless others with them, whether or not that's in Guatemala, another country, or just your neighbor's home. Continue to bless those and just help them where they're at this point in their life. The reward is great.